Hello and welcome to another Saturday session. This lesson will be focused on topic 6 in the Lebenstherapy curriculum and specifically focusing on drugs in sport. So the learning outcomes for today are to describe the different categories of performance enhancing drugs, giving examples of how they can affect performance, to analyse the implications for the performer and the sport of using performance enhancing drugs, to describe the current Irish anti-doping rules, including the ways in which they are enforced, to explain a therapeutic use exemption in relation to the use of medicines in sport, and to discuss the implications of using performance-enhancing drugs for the performer and the activity. So the first learning outcome that we're going to look at today is to describe the different categories of performance-enhancing drugs, or PEDs, and giving examples of how they affect performance. So the action verb describe means to develop a detailed picture and image of. So for each performance enhancing drug, we need to know the examples of them, how the performance enhancing drug affects performance, the side effects or negative risks or implications of using the performance enhancing drug, and the sports or activities in which they might be used. So the most widely known performance enhancing drug would be anabolic steroids, and examples of this include testosterone and nandrolone. And they often come in clear liquid form and are often injected into the body. The uses and effects of anabolic steroids are accelerated hypertrophy. So hypertrophy just means increases in muscle mass, and accelerated means faster than normal. So again, you're looking at faster than usual rates of muscle mass gain, faster than usual rates of power and strength gain, accelerated recovery in between sessions so that more training can be done, and increased fat metabolism. The side effects of anabolic steroids are risk of liver and kidney damage, increased aggression or mood swings, or a risk of paranoia or feeling anxiety, increased risk of heart disease and failure, and acne is often a side effect of anabolic steroids, and facial hair in women is another side effect of anabolic steroids. Sports that they're most commonly used in are strength sports, so sports that involve producing high forces, so strongman is an example of that. Other sports where they're commonly used are sports that are focused on the fitness components of body composition, so increasing muscle mass and reducing fat mass. Sports associated with power and speed, so two other fitness related components, so performance related fitness components there as well. So obviously increased power, strength and muscle mass can also yield improvements in sports that focus on power or speed, such as Olympic weightlifting or sprinting. So the next performance enhancing drug is human growth hormone. So similar to anabolic steroids, their main purpose is to get a faster than usual rate of hypertrophy or increase in muscle mass than would be achieved without the use of human growth hormone. They can also be used to increase blood glucose levels, so increase glucose in the blood, which can be used as an energy source, and also accelerate muscle recovery between sessions so that more training can be completed. The side effects of using human growth hormone, so increasing the risk of developing diabetes. So with an increase in glucose in the system, that can predispose someone to developing diabetes. increase the fat levels in the blood as well is another risk, which can increase the risk of heart attacks or strokes, and also to increase the risk of heart disease. So similar to anabolic steroids, they're used in sports that are focused on strength, body composition, and power. But endurance athletes may also use human growth hormone, as the increase in blood glucose can provide energy for endurance events. Another example of a performance enhancing drug is beta blockers. So examples of beta blockers include salbutamol and propranolol. So beta blockers' main function is to reduce heart rate. Other effects of taking beta blockers include inhibiting the effect of adrenaline, which gets you fired up, prepares you for flight or fight activities. It can reduce trembling or shaking when performing an activity, and can also reduce anxiety or blood pressure. So the side effects or negative implications of taking beta blockers are that they can increase your fatigue, because more blood is getting to the working muscles due to the reducing blood pressure. So the main function of them is to reduce heart rate, so they may reduce heart rate and blood pressure too much, and can sometimes result in heart rate reducing to the point where the heart stops. So the sports or activities that they are commonly used in are sports that involve fine motor control. So such examples include shooting, archery, darts, and snooker, where very fine or precise movements are required. So the reduction in trembling, shaking, and anxiety can facilitate performance in these activities. Beta blockers such as propranolol often come in pill form and can be purple in colour, so it can be a nice way to remember the beta blockers. So the next performance enhancing drug that we're going to look at are stimulants. So examples of stimulants include amphetamine, ephedrine, and cocaine. And their main purpose is to increase focus and alertness. They can also increase energy and prolong performance over longer periods. They can increase aggression rates in sports that may require increases in aggression or large amounts of aggression, and they can also reduce pain. Side effects to stimulants include the ease at which a person can become addicted to them. So, as well as that, stimulants, while they increase aggression, and that may be the reason why someone takes them, it can also be a negative side effect if aggression is not controlled or becomes excessive. They can increase anxiety or insomnia, so can make it very difficult to sleep, and they can excessively increase heart rate or blood pressure to the point that health is compromised. The sports that stimulants are most commonly used in are contact sports that require high levels of aggression. So the likes of rugby, American football is another example, and sports that require high levels of alertness are other examples where stimulants may be used. So sports that rely heavily on reaction time, which is another performance-related fitness component, such as tennis or baseball, where the athlete is reacting to a stimulus that is occurring quite quickly. Stimulants often come in pill form and are often white in colour. The next performance enhancing drug that we're going to look at is diuretics. So examples of diuretics include benzoflumetazide. So this example is a pill which is often blue and white in colour, and the purpose or the uses For diuretics include making athletes require the use of the bathroom more frequently, so more urine is removed, and in turn that will then make other performance enhancing drugs harder to detect because more urine is being removed, and as the primary way of detecting performance enhancing drugs is through urine tests. Because of the removal of more urine, faster weight loss is also achieved. The side effects of diuretics include failure of the heart or kidney, dehydration due to fluid loss through more urine being removed, nausea or the feeling of being sick, headaches, or muscle spasms and cramps. And the sports that they are most commonly used in are sports that involve weight categories, so athletes attempting to achieve a particular weight in order to compete. So the loss of water weight through the removal of urine facilitates them being able to achieve perform in a certain weight category. So weight category sports include boxing, MMA, weightlifting, and those involved in horse racing, so jockeys. Other sports that they're used in is any sport where an individual is trying to hide their use of performance enhancing drugs. So anyone who's using performance enhancing drugs can use diuretics. The next performance enhancing drug that we're going to look at is narcotic analgesics. So analgesics are substances taken to reduce pain, and examples of narcotic analgesics include morphine, which is often used for pain relief, and the standard painkillers. So the effects of narcotic analgesics are to reduce pain, to help athletes to play through injuries through the reduction of pain, and also to reduce anxiety, which may be caused by symptoms of pain. The side effects of this performance enhancing drug is large swings in mood, injury risk due to athletes playing through pain, and the lessened pain that they experience due to taking this performance enhancing drug. They also inhibit the central nervous system, which can decrease your alertness or your focus, and they can also inhibit balance and coordination. So the sports that they are often used in are sports involving fine motor control, such as shooting or archery. They are often used in contact sports, where athletes are trying to play through pain, and also in endurance sports, where athletes are trying to tolerate large amounts of pain, for example, cycling. This performance enhancing drug can often come in pill form, can be white in colour, or can come in liquid form and can be injected and is often clear in colour in this form. Another performance enhancing drug is peptide hormones. An example of this is EPO or erythropoietin. So the use or the effect of this performance enhancing drug is to increase hemoglobin production or red blood cells in the blood, which allows more oxygen transport to muscles and therefore allows aerobic respiration to take place. And as a result of aerobic respiration, ATP is broken down, which provides more energy, which can be used in sport or activity. They also can be used to recover quickly between high intensity efforts such as sprints. And the way they do this is by buffering the amount of acid in the muscle and replenishing phosphocreatine reserves so that intense efforts can be maintained at a very high intensity. The side effects of using this performance enhancing drug is increasing the thickness or the viscosity, which means thickness of the blood. And therefore, with thicker blood running through our veins and arteries, it increases the risk of blood clots and also increases the risk of heart attacks, strokes, and blood cancers. The sports that is most commonly used in are endurance sports, such as cycling or marathon, and it often comes in liquid form, is often injected, and is clear in colour. So obviously with the endurance sports, more energy and more aerobic respiration will be beneficial to performance, which is why they are most commonly used in endurance sports. So our next example is a performance enhancing method as opposed to a performance enhancing drug, which is blood doping. So blood doping is when the performers or athletes have additional blood added to their bloodstream. And how they do this is blood is removed or taken from the body and then frozen. The body then naturally replaces the blood that was removed, and then immediately pre-competition or just prior to competition, the blood that was removed and frozen and stored is re-injected. And then the effect of this then is to increase the red blood cells in the body, which then increases oxygen transport to the muscles, and again can increase aerobic respiration and provide more energy for activity. The side effects of blood doping include increasing the viscosity or the thickness of the blood, and then again increasing the risk of blood clots because of thicker blood in our veins and arteries, and this can increase the risk of blood clotting. Similar to peptide hormones, there is an increased risk of heart attacks and strokes. There's also a risk of kidney failure, and also infection from the re-injected blood can also occur, especially if this blood isn't stored properly or goes bad in the time that it is being stored. So the sports that it is used in is endurance athletes such as marathon or cycling, as increased oxygen transport to the muscles is important for these sports, which rely on aerobic respiration primarily, and the breakdown of ATP to provide energy. So a practical task or some homework that can be done to try and remember the uses of performance enhancing drugs and also the side effects in the sports that they're used in is to write out the tables in the previous slides in a similar format, similar table format as they are presented, and then give them to a partner to quiz you on. So the first scenario that this can be used in is where the partner picks examples and asks what the uses and effects of a certain drug is. They can ask what the side effect of a certain drug is, and they can ask the sports that would use a certain performance enhancing drug. So, for example, your partner could ask you to give an example of the side effects of morphine or painkillers. So they're asking you to provide a side effect of one of the examples of narcotic analgesics. Or they could ask you to provide a side effect of narcotic analgesics in general. So they could ask you also to provide the uses or effects for taking particular anabolic steroids, such as testosterone, so they could name one anabolic steroid, or they could just name anabolic steroids in general. So in examinations, you could be asked for the uses or effects, the side effects, or the sports that would use a certain performance-enhancing drug, so anabolic steroids, or you could be asked for a very specific example of an anabolic steroid. So you could be asked to provide the sports that would use testosterone or nandrolone. And this highlights why it's important to know the examples of each of the performance-enhancing drugs. The second way that this practical task can be performed is that your partner picks a particular sport and asks what are the examples of performance-enhancing drugs that can be used in that sport, what are the uses or effects of the performance-enhancing drugs that can be used in that sport, and what are the side effects of performance-enhancing drugs that can be used in that sport. So for example, your partner may ask you to provide an example of performance-enhancing drugs that are used in contact sports, or they name the specific sports such as rugby or American football. And they may also ask the uses or effects of that particular performance-enhancing drug in that activity, or the side effects. And this can be used as a revision tool for performance-enhancing drugs. I'm discussing examples, uses and effects, and side effects. So the next learning outcomes that we're going to look at are to analyze the implications for the performer and the sport of using performance-enhancing drugs, and to discuss the implications of using performance-enhancing drugs for the performer and the activity. So if we look at the action verbs here, so we're looking at to analyze, which means to examine something in detail, to break down in order to bring out the essential elements or the structure, to identify the parts and relationships, and to interpret information to reach conclusions. And to discuss means to offer a considered, balanced review that includes a range of arguments, factors, or hypotheses. The opinions or conclusions are supported by appropriate evidence. So as we can see, both of these learning outcomes are quite similar. They're both looking at the implications of using performance-enhancing drugs for the performer, but also for the sport and the activity. And if we look at the action verbs, and particularly the highlighted in sections in bold, the action verbs, so if we look at identifying the parts and relationships and including a range of arguments, this is referring to including the reasons why a particular athlete may use performance-enhancing drugs, and also referring to the negative implications of taking performance-enhancing drugs. So looking at both sides of the argument or the relationship with performance-enhancing drugs and their use, and then providing enough detail outside of that on the use of performance-enhancing drugs and the implications. So just to sum that up, so the two highlighted sections in bold are included here. So including a range of arguments or identify the parts and the relationships. What that's referring to is why the athletes are taking the performance-enhancing drugs versus the implications for taking those performance-enhancing drugs. So you're including a balanced argument in your analysis or your intrinsic awards, such as fame and fortune. Several reasons why an athlete might take performance-enhancing drugs. Firstly, the social reasons. So extrinsic rewards, so rewards such as fame and fortune, financial gain, and the achievement of winning trophies or competitions may be appealing to athletes and may encourage them to take performance-enhancing drugs. So, for example, Lance Armstrong, who won several Tour de France competitions, had a $125 million net worth at his peak. So again, had a huge fortune amassed, which was aided by his use of performance enhancing drugs. Another social reason why performance enhancing drugs might be used by athletes is the attitude that winning using any means necessary or winning at all costs is adopted by the athletes. And in the Lance Armstrong Oprah Winfrey interview, he admitted that he wanted to win at all costs, and that included taking performance enhancing drugs. External pressure might be applied by family, coaches, or the media to use performance enhancing drugs. An example of that is the coach Remy Korchemny, who is currently serving a lifetime ban for supplying and pressuring athletes into using performance enhancing drugs. Then lastly, another reason for taking performance enhancing drugs is so that the athlete can maintain a competitive edge in their particular sport or activity. So if you look at the sport of bodybuilding, in the 80s, when Arnold Schwarzenegger was competing, the vast majority of bodybuilders competing at a very high level were using performance enhancing drugs. And Arnold Schwarzenegger admitted recently that in order to compete, he knew that he would have to use performance enhancing drugs. The physiological reasons for using performance enhancing drugs can be obtained from the tables giving detail about the uses or effects of performance enhancing drugs. So if you review the first few slides in this lesson giving details on the effects or uses of performance enhancing drugs, they will provide the physiological reasons why an athlete might take performance enhancing drugs. So for example, an athlete in a body composition sport such as bodybuilding might use anabolic steroids to accelerate their muscle mass gain, their strength gain, their recovery, and also to increase their fat metabolism. And this is an example of several physiological reasons why an athlete may use performance enhancing drugs. So while there's several reasons for an athlete using performance enhancing drugs, there are definitely implications for the performer from using performance enhancing drugs. And the implications include the health effects. So if you refer to the earlier slides on each of the performance enhancing drugs and look particularly at the side effects of each particular drug, they will provide the health effects and implications for the performer of taking performance enhancing drugs. Sanctions and fines are another implication of using performance enhancing drugs. So if an athlete who's using performance enhancing drugs is caught or test positive for using a performance enhancing drug, they may have their title removed, such as Ben Johnson, and that happened to him days after competing in the 1988 Olympics 100 meter sprint, and his title was immediately removed. Another example would be a fine. So Maria Sharapova tested positive for an illegal substance in 2016 and was fined $250,000 for the presence of the banned substance, and then was also banned for 15 months for testing positive for the banned substance, which was added to the list of banned substances by WADA in 2016. Another implication is the loss of sponsorship. So Maria Sharapova lost her sponsorship deal with Nike, which was reportedly worth $70 million. That was another implication of her testing positive for a performance enhancing drug. And lastly, a loss of reputation is another implication for an individual performer for taking performance-enhancing drugs. So if we look at the example of Justin Gatlin, who previously tested positive for performance-enhancing substances, was not invited to a Diamond League track event in China due to his reputation with performance-enhancing drugs after failing the drug test. And another useful activity for you to engage in is to Google your own examples of different implications for performance-enhancing drugs. So Googling different examples of health effects, sanctions and fines, losses of sponsorship and of reputation, and finding your own examples that you can use when answering questions on the implications for the performer of taking performance-enhancing drugs. As well as having implications for the individual performer, the use of performance-enhancing drugs can have implications for the sport and the activity the athlete is taking place in. So one implication is that there is an uneven or unfair playing field and records broken due to the use of performance-enhancing drugs, and that records are broken and set and they are simply unattainable without the use of performance-enhancing drugs. An example of this is Ben Johnson in the 1988 100 meter sprint Olympic final, as his sprint time of 9.97 seconds was a world record at the time. Another example of an implication is the loss of sponsorship for a particular sport. So companies don't want to be associated with sports or activities that may hinder their reputation and may affect business or potential revenue for their company. So an example of that is after Lance Armstrong was exposed for his use of performance-enhancing drugs, the 2007 Tour of Utah was cancelled due to lack of funding from the main sponsor. A loss of reputation is another example of an implication for a particular sport or activity. So if an athlete in a particular sport tests positive for a particular performance-enhancing drug, all the athletes in the sport can be questioned as to whether they are also using performance-enhancing drugs. And a real-life example of a loss of reputation for a sport was a 52% drop in television ratings for cycling after the Lance Armstrong scandal. And again, Google your own examples for records being broken, loss of sponsorship and loss of reputation due to the use of performance-enhancing drugs. And if you're given a case study in an examination, make sure that you refer to the case study when you're answering the question. So for example, if you were given a case study on Lance Armstrong and you were asked for an implication for the sport or the activity of Lance Armstrong being caught using performance-enhancing drugs, you may say the loss of reputation as an implication, and you may use the 52% drop in TV ratings as an example of the loss of reputation, or there may be another example of a loss of reputation in the particular case study in the examination. So make sure to refer to examples from a case study or that you have yourself when you're answering in an examination. So our next learning outcome is to describe the current Irish anti-doping rules, including the ways that they are enforced. So if we look at our action verbs, describe means to develop a detailed picture or an image of. So when we're answering questions on the Irish anti-doping rules and how they are enforced, there's three things that we need to know. We need to know the anti-doping rule violations. We need to know how these rules are enforced in Ireland, and we also need to know the sanctions for the violations in Ireland. So before we discuss these, there's a few key terms and definitions that we need to look at prior to examining the different rules, sanctions, and how the rules are enforced. So WADA, it refers to the World Anti-Doping Agency, and they set the global anti-doping rules. And then in Ireland, Sport Ireland is the association who manage the Irish anti-doping programme to ensure that Irish athletes are not using performance-enhancing drugs. Doping is the use of performance-enhancing drugs by athletes. The PED, as we referred to earlier, is a performance-enhancing drug, which is a prohibited, so an illegal performance-enhancing substance that you're not allowed to use. And that is set out by WADA. So WADA set out a list of substances that are prohibited. Anti-doping refers to prohibiting illegal doping, so trying to prevent illegal doping or the use of PEDs. An anti-doping rule violation, or ADRV, refers to committing a doping offence. So when an athlete is caught committing a doping offence. And a biological passport is something that all national level athletes in Ireland will have, and it's an electronic record where their biological markers are profiled or tracked over time. And this is to try and monitor whether performance-enhancing drugs are being used. The Irish anti-doping violations are presented here. There will be 10 of them presented in this lesson, and for the purposes of examinations you need to be able to remember 5. So these first 5 refer to banned substances or banned or prohibited methods. So firstly, have the presence of a banned substance in a sample, the use or the attempted use of a substance or method. So again, trying to use a banned substance or method or actually using them is also a violation. Simply possessing a prohibited substance or using a prohibited method is another violation. Trafficking, so transporting or attempted trafficking of a prohibited substance is a violation. And administration or attempted administration of a prohibited substance, so trying to use a prohibited substance, is also a violation. So a little mnemonic device to try and remember this is UPTAP. So we have our use, we have our presence, we have trafficking, we have administration or possession of prohibited substances or methods. Another anti-doping violation in Ireland is evading, refusing or failing to submit a sample when requested to do so. Committing 3 whereabouts failures in 3 months is another violation. So an athlete must inform the anti-doping agencies of Sport Ireland in Ireland about their whereabouts consistently, and again, not informing them of your whereabouts 3 times in 3 months is a violation. Tampering or attempted tampering with any part of doping control is a violation, and so is complicity. So assisting, aiding, abetting or covering up a rule violation is another violation. So an example of this is an athlete giving a urine sample or pretending to give a urine sample and attempting to use someone else's urine that isn't tainted with performance-enhancing drugs. So both people, the athlete who used someone else's urine and the person who provided the urine, would both be committing a violation in this instance. And lastly, association is also prohibited. So association with any person who is serving a ban is a violation. So again, appearing in a social media post with a person who is serving a performance-enhancing drug ban is another violation. So Sport Ireland enforce these violations and the rules on athletes and also on clubs. So firstly, with regard to national level athletes, they have to take part in blood testing in order to test for the presence of performance enhancing drugs. They must log their whereabouts. They must let Sport Ireland know where they are present at regular intervals. They must have a biological passport that can be used to track whether performance enhancing drugs are being used. So, for example, hemoglobin can be tracked in a biological passport to test for the presence of EPO. They can be tested in competition 12 hours pre-competition until the end of a competition, and they can also be tested at any time. And they must select 1 hour of every day to be tested. Sport Ireland also enforce these rules with clubs. So any clubs who receive funding from the government or from Sport Ireland, they must comply with the anti-doping regulations and rules. They must report ADRVs, so anti-doping rule violations, and they must also apply sanctions to athletes who break the violations, break the rules, and they are responsible for providing anti-doping education to their own members. The sanctions for committing an anti-doping rule violation. So for the first one, it's a 2 to 4 year ban, forfeit of any medals or trophies won, and avoiding any results that were achieved. 3 anti-doping rule violations in 10 years results in a lifetime ban from the sport. And 3 whereabouts failures in 3 months will receive a 2-year ban. So that's the consequence for not letting Sport Ireland know your whereabouts 3 times in 3 months. If an athlete is banned, then any funds they may have been receiving from Sport Ireland may be withdrawn. If 2 or more members of a team commit a violation, then the whole team may be sanctioned, and the national government bodies who commit violations may have any funding removed or their status as a Sport Ireland recognised sport removed. So our next learning outcome is to explain therapeutic use exemptions in relation to the use of medicines in sport. So explain means to give a detailed account, including the reasons or the causes. So a therapeutic use exemption is an exemption that allows an athlete to take an otherwise banned substance to treat a medical condition that they may have. So a substance may be on the banned list that's provided by WADA, but it can be taken for a certain period of time to treat certain medical conditions. And athletes must fill out forms that have to be granted by Sport Ireland for using a substance, and they must also be approved by a medical professional. An example of a therapeutic use exemption application form is shown here. There's 3 conditions required for a therapeutic use exemption. So the athlete must need the therapeutic use exemption on medical grounds. They must not gain any competitive advantage from taking it, and there must be no alternative remedy or other treatment available that they can take for their condition. If the athlete doesn't meet any of the above 3 criteria, they will not be granted the therapeutic use exemption. So examples and more detail on therapeutic use exemptions. So 2 athletes that have used therapeutic use exemptions are Chris Froome and Simeon Biles. So Chris Froome has an asthma therapeutic use exemption and can take Ventolin, which increases his breathing capacity. And Simeon Biles has an ADHD therapeutic use exemption and can take Adderall, which improves her focus. There are 18 exemptions for a therapeutic use exemption to be granted. They include a range of conditions, such as those listed in the slide. It's important to note that not all therapeutic use examples are granted. So, for example, in 2017, only 27 out of 81 therapeutic use exemptions were accepted. Thanks very much for listening to today's Saturday session. I hope it helped. Best of luck with your studies. Thank you.